Welcome everybody. We are very happy to have a great guest for the next pre-talk to our Knowledge Festival. I will give you a short introduction. It has to be short because there is so much to say, but Dr. Senthilkumar is a Siddha doctor and completed his degree in Siddha Medicine and Surgery in '92, and obtained a master's degree in '97 and PhD in 2005 in medical physiology, and did some postgraduate Institute of Basic Medical Sciences, University of Madras. In 2003, he received the Sri Nageshwara Rao Pantalu Prize for the best research in the field of medicine from the University of Madras, and followed by the doctoral degree. He has done the postdoctoral studies at the University of Chicago, USA, between the years of 2005 and 2011. And then he worked as an assistant professor in research from 2011 to 13 at the University of Illinois at Chicago. He worked there for about 7 years. And there are so many awards there. He has been the best employee from the Department of Medicine, University of Chicago, for his contribution in medical research. He has published 10 research articles in peer-reviewed international journals, such as the Journal of Clinical Investigation, the Journal of Biological Chemistry, and so on. And he has delivered many invited lectures in conferences. A member of American Heart Association, and currently a life member of Indian Association of Basic Medical Scientists. And currently he's working as assistant professor of physiology in the National Institute of Siddha in Chennai. There are so many more things on his CV that I just, if I go on, I will take up the whole live feed. So without further ado, I give it over to you. And he's going to, because we had our first Siddha introduction at the first pre-talk, which was very great to understand the basics. And now he is, our guest, Dr. Senthilkumar, is going into the distinctiveness of the Siddha medicine. And therefore, I give it over to you, and please, sir.
Yeah.
Sir, you're muted. Just that. So it's to you.
Okay, I can share screen, right?
Yes, you have
yes.
everything at your disposal.
Okay, thank you. Full screen.
Stop sharing.
Hmm? I get a stop share. So what to do now? How to share the screen? I could not hear you.
We can see that the sharing works.
Oh,
So,
you can able to see that? I go to the
yeah.
okay,
It's fine. It's fine. Perfect.
Okay.
We see your whole.
Okay.
Absolutely. Yes.
Okay. Yes. I can go now. I'm good.
Yes. It's all
Can
yours.
you hear me well? Yeah,
Yes.
okay. Right.
Everything perfect. Thank you.
Okay. Thank you. Good evening to everyone. It is first of all, I thank the organizers for an attempt who has given me an opportunity to share my thoughts about the Siddha system of medicine. Also, take this opportunity to thank Dr. Vinayak Nair for giving this platform to share about the Siddha system of medicine, its basics, and its distinctiveness of the Siddha medicine. Siddha medicine is an ancient Indian traditional medicine. Has been practiced uh, extensively in Tamil Nadu, southern part of India, as well as the Tamil-speaking regions of the world. People do practice the Siddha medicine. It is one of the ancient medicine of the world, basically. It is if you look at the origin of the word Siddha, Siddha is derived from the word Siddhi, which means attainment of perfection or accomplishment, basically. Okay. It was found by the 18 saints, Siddhas. Those are philosophers, and some of them are writers, some of them are physicians, some of them are plant therapists. All they found this Siddha medicine. They worked for relentlessly to attain the perfection. They thought that to attain the perfection, disease or the healthy living is very important. To achieve that, they evolved this medicine, that is a Siddha medicine, basically. Siddha medicine is considered the human subject as a whole, body, mind, and spiritual. It increases the body strength, enhance the immune function, bring back the homeostasis, that is the body equilibrium. That is the goal of Siddha medicine. One of the ancient Siddha, Tirumular, was inscribed the text called Tirumandiram. It defines medicine. Medicine is which prevents, which cures the ailments as well as of the physical and the mental stress, which can prevent disease as well as which should help to achieve the immortal. So you can understand the highness of Siddha medicine. So it's a If you look into the basic principles of Siddha medicine, Siddha medicine considers man as a microcosm, universe as a macrocosm. So whatever that is in the universe exists in the man. That's what it believes. The universe is made up of the 5 elemental theories. We call it the Panjabhuta theory, actually. So earth, water, fire, air, sky. So similarly, the body, the microcosm, the body also derived from these 5 elements. Okay, it goes nature and man are the one-to-one. It's what it believes, actually. This 5 elements also responsible for the physical and the functional conscience of the human being. That is what they said actually. There are 7 basic tissues. We call it in Tamil, Yeru Udar Tadukal, which are also is constituted by these 5 primordial elements. The 7 of them are lymph, blood, muscle, adipose tissue, bone, bone marrow, nervous tissue, sperm, ovum. All the 7 elements are formed by the 1 or 2 combination of these primordial elements, that is Panchapudas, one of them. For example, blood is formed by the fire and water. The muscle is formed by earth and water. The adipose tissue is formed by the water and earth. The bone, which gives shape and mobility to the man, it is formed by the earth and air. Again, the bone marrow, which releases the blood cells and the immune function conducts, all is formed from the water and air. The sperm and ovum, which are formed from the fire and air. So they believe that the physics of the human body evolved from the primordial elements, the 5 elements. Similarly, the functional elements we call as 3 vital factors. We call it as the Uyir Tadukal, which helps for the body function. They also arises from these 5 elements. They call Vali, Adal, Ayyam. Vali, Adal, Ayyam. Other name Vada, Pitta, Kapha. They call it as a 3 vital factors. In this, the Vali, which arises from the air, responsible for the movements of the respiratory, cardiac, and neurological function, it is considered as a creative force. Adal, which arises from the fire, functions the body for such as digestion, cell production, maintenance of body temperature, intellectual and vision, and the color to the skin are given by the adal. So it is a kind of a sustaining force of the body. The third one is ayam, okay, otherwise called kabam, which is formed by the water, gives a strength, stability to the structure, support the functions of the respiratory and other vital symptoms. Also, it is helpful for the appreciation of the taste and the eye, visual function of the eye, and digestion and lubrication of the joints. It is otherwise called destructive or eliminating force of the body. Let's say considered. But this is considered the functional elements. So, human body, which is made up of the 5 primordial elements, are supported with functional and the Udar Tadukal, that is the 7 Tadukal, the physical structure. So, any change in this Vali, Adal, Ayyam, okay, that is the functional deviation. They must be maintained at the ratio of 1/2 total. Vali 1, Adal half, the Ayyam is a quarter. This is in the normal homeostatic condition. This has to be the ratio of these 3 vital factors has to be maintained. Any deviation or vitiating of these 3 vital factors considered as a disease. The measures are taken to prevent the deviation of these factors, or drugs has been given to bring back this to the normal status. That is the way. So, how the Siddha system diagnoses a disease? It is a 2-way. It is okay. That is about the no further. That is first recognize the disease, then Noi Nadi. Noi Nadi means look for the cause of the disease. These are 2 paths they are using this. First, you what is the symptoms of the disease? Then Noi Nadi, that is what is the cause behind the disease. This is one. They use two diagnostic principles basically. One is called N Vagai Theervu. Other is called the 8 criteria for the physical examination. Other one is called a Neerkuri Neikuri. So first let me finish this. What are the N Vagai Theervu, 8 criteria for the physical examination to look into? First, the tongue examination, change in the color or the surface of the tongue as considered as any change in is considered a disease or the normal. Similarly, color complexion, change in the skin or any discoloration or any paleness, all this as we consider when you look into that, a physician look into that. Similarly, voice examination, the flow of the voice changes upon any condition or how it is. Then eye examination. So they look for the discoloration of the eye. For example, any jaundice or any kind of this, there's a discoloration. So eye is one of important criteria in the N-Vagai Theervu. Similarly, they do the stools examination, urine examination, touch and palpation. That is called parisam in Tamil. They look for the touch and palpate the body wherever they say any kind of dysfunction or pain or that. That is the thing they teach. Then they look for any inflammation or swelling. All this will be by simply touching over the skin. They try to evolve. That is the one thing. Then the pulse examination. So that is one of the uniqueness of the system of medicine. So the pulse examination is used to look for any change in the three vital factors called Vata, Pitta, Kapha, basically. This can be measured in the 10 points of the overall world. Most preferable point you can measure this pulse, the nadi, is the radial artery. Over the radial artery, three fingers, that is index finger, middle fingers, and ring fingers, are kept over just 1 inch above your thumb, actually. So look for you slowly and feel surface of the artery, place the fingers, and look for the rhythm, the rate, or the volume of the flow. So each finger feels a different kind of that rhythm. So with that they can. So normally the valley, that is a one badam, which is felt by your index finger, then it is normally one. Then they slowly look into the like a like you're doing in the guitar. So one by one, like first they look into badam using the index finger, then using the middle finger look for the aral, which is after your valley. Then they use the ring finger to feel the ayam. It is the 1/4 of the valley. So this rhythm is considered as a normal. So this is the way they examine. So is there any change in their ratio? So one, if it is Vadam goes half, the adult goes one. So that is considered as a disease condition. The medicine or the lifestyle recommendation or diet has to be based on to bring back this whatever increase adult into half. So that is way they have go for the treatment aspects. So that is the one other thing, the diagnosing the disease. Then other one is the looking of the urine examination. It's called Neerkuri Neikuri. Neerkuri means simply seeing the urine. So the color, smell, quantity, how much quantity of the urine, how frequent the person goes urine, specific gravity, any frothiness in the urine, considered as a Neerkuri. So simply seeing the urine, you can able to evolve the condition of the person physically. Then other some little bit advanced one is called Neikuri. What they do in this method, a drop of gingerly oil will be dropped over the sample. They look for the spreading pattern of the oil that exhibits over the surface, okay, or the urine. Based on that, they come to some kind of confirmatory test. They do that actually. It's one of a very unique and confirmatory diagnostic tool. Normally, if there is an increase in vadam or change in vadam, this spreading pattern of the oil will be like a serpentine, it goes here and there. When you look for the pittam, that is the initiation of or increase in the pittam, that will cause a kind of a ring kind of space, ring kind of spreading of the oil happen, and it is goes slowly like a bigger in size, like a wave it just comes. So when there is a change in the pitta. In case of IM, any change in the IM, that will be like a pearl, that is like a drop over the surface of the urine you can able to see. So this way. Again, is there again one more thing I want to say, Vada Pittam. That is a disease which can deviate the Vada and Pitta. So that shows a different kind of pattern over the surface of the oil. So that is how they do it. So here I can show that. See, you can see this picture, how the first urine collected from the patient will be collected in a bowl, glass or a porcelain bowl. Then they instill a drop of gingerly oil. So you can see a oil over there, a drop of oil. So this is how they look for it. So it varies with the normal and disease condition. That's how they do it actually. Then this is used a mercury color code in the hospital basically. So according to the color of the urine, so they evaluate the disease condition. In this, the first line, second one is considered as a normal urine. So which gives a kind of a fruit juice color. It is normally a fruit available in Tamil Nadu, turunji param. Okay, so it will give a normal person's urine will be like a turunji param's color. That is what the fruit, turunji fruits. That is the color. The second one, the first line. So other line shows the different condition where the urine color changes. If you look into the last row, this is a white color. Whenever the kabam increases, which shows the white color, the pale white color will be there. So that is the thing happen. Similarly, if a person suffers with the pitta disease, okay, jaundice, so the fourth line, you can see the brownish color. So that will happen when there is any bile dysfunction. The urine color will be look like that. So it can be matched with, and you can evaluate the disease. These are the two things. This mercury and the neikuri are used to diagnose the disease in Siddha system of medicine. So this is about some of the basics of the Siddha medicine. Now, they also recommend many important methods to prevent as a preventive measure, also the promotion of health. It is called Pini Anugha Vidhi. Pini Anugha Vidhi. Pini means no. So there is a Vidhi mean rules. The rules that prevents getting into the disease, or the prevent the rules that can promote health. So two things they are telling it. This concept of the Pini Anugha Vidhi is pertaining to three things. Habitat. This habitat in the sense the person where he lives plays a major role. Okay. According to the Tamil culture, the person who lives are classified into 6 places. That is where there is a plains are there, the person who lives near the seashore, the person who lives in the mountain, the person who lives in the near the hill, all this thing. So determines how they have to follow their food habits and how their 3 vital factors get altered. Based on that, this recommendations are given. Similarly, Nal Urukam and Kala Urukam, seasons. In Siddha, they divides the day into six divisions, that is six siru பொழுதுகள். Similarly, the year also divided into six, that's called perum பொழுதுகள். So they also mentioned about each day. So what kind of things has to be maintained in day-to-day life. So that's called நாள் ஒழுக்கம். Again, other one is a kala urukam. Kala urukam thing, the each season, like a summer season or rainy season, the what need to be followed. That also they recommended. That what kind of the diet has to be followed based on their thinai, that is where they live and where and what time and what season they have to follow. So they all recommended to the each people has to follow. This is a picture shows, so see how the three vital factors are up, goes up and down during the, this is called the like a circadian rhythm. There's a modern text talked about actually. So the changes of this uyir thadukal varies with the time. Morning vadam goes up. So in that case, you have to take a drug, that is, or take a food or make a, maintain a lifestyle that try to bring down the vadam towards the normal. So where there is a predominantly the vadam. Similarly, noon the pittam goes up. So other two are goes down. So your food has to be such a way designed to bring down the pittam during the noon. In the evening, the kabam goes up. So the things you should do and also the food need to follow should try to bring down the increased kabam, that is the time. So this is the thing, they are cyclic representation about the three which vital factors we call in the day, how it has to be followed. Other than that, the Therapy Siddha also recommends some of the food habits and lifestyle for the good health. So he says that it may be the, it is still, it is applicable to the contemporary world, that drink water after boiling, take a food only twice a day, that is enough. Then take diluted buttermilk and melted clarified butter. Then take a sufficient quantity of cow, that is only the calcium source they mention about it. Then other than that, the uniqueness of this is they also recommend three things: emesis, purgation, and the oil bath and collyrium. Emesis mean you induce vomiting once in 6 months to detoxify your upper portion of the stomach. That's the thing I can say. The other one, once in 4 months, they advise for purgation. So it is certainly, it is now we are more talking about microbiomes and all. So every 4 months, they just get rid of whatever in the intestine, giving the purgation. The person will be given for purgation and they start to give a new medicine. So it helps to grow a new flora, microbial flora in the intestine, which is good or bad. So this is one thing. So as a physician, when we start medicine in Siddha medicine, we first ask the person to, we try to give a purgation first. So whatever the toxins that is first eliminated during the purgation, then we start to give the medicine, which is required according to changes in three vital factors: Vali, Aral, Ayam. So that is how they do it actually. So these are some of the thing. Also, they are recommending the oil bath. That is the one thing which helps to regenerate the skin and also the body blood flow. And again, the nerves get stimulated. All this, the thing they are recommending once in every 4 days. Once in 4 days, they recommend the oil bath. These are some of the things. Again, collyrium, that is a medicated eyeliner, is available. Once in 3 days, apply this collyrium to the eye. So it helps to clean the eye and keep your eye getting affected with any disease. That is their advice they continue. So these are some of the good health practices recommended by the Therier in Siddha medicine. Other than that, some of these things are important food habits for good health. They say that in Tamil, முதல் நாளில் சமைத்த கறி அமுத் எனும் marundum. That means if you don't take the leftover food or any processed food, try to avoid. It was said almost 2000 years back. Now still it is applicable, I think. So the processed foods, which is responsible for many of the non-communicable diseases nowadays, which has a high amount of salt, preservatives, trans fat, all that, which is the processed food. It was advocated in Siddha medicine long time back. Never go or never take any kind of processed food. So try to take something fresh that is good for health to maintain your health well. Then similarly, they also say that the Thiruvalluvar, so he also said that Siddha also mentioned that avoid taking food without appetite. So once you feel hungry, take food. Don't dump your stomach. Just like that. So we should never go for food on time. We should go take food based on our requirements. So ask your body what it wants. Don't go by your wish. Okay, I want to take a coffee. Not that. Whether you can ask a question to you that does the body requires that? Or so it requires water or it is coffee. So that you decide. Then you go behind that. So that is what the so avoid taking food without any appetite. So wait until you get hungry. Then you go for the appetite. So that is another important thing they tell about the how to take food in the normal way. Then they also suggest for the physical activity probably. So in Tamil they're saying that Nandu pera undapin kurunadayum pailvu. That means have a short walk followed by each meal. Basically, they are saying that because the figure shows if you person what is the health benefits of the physical activity shown here. So many of the condition, cardiovascular or respiratory condition can be avoided if you have a good physical activity. So it was emphasized in long time back in the Siddha system of medicine. The physical activity is essential to maintain a good health all over, basically. Again, the Siddha recommends the different kind of diet regimens. They said that as well as prevention, as well as the treatment of disease, they recommended food is medicine, medicine is food. That is, so you understand this. Food is itself a medicine. You don't go for a drug actually. So that is the concept they try to bring it here. So take a food that is helpful to treat yourself, make yourself healthy properly. That is the one thing. They again another important thing they're saying that that means the grain that is cultivated in the particular soil should be served as a food for the people who lives there. That is very important. A person, as I said earlier, that is the human beings are microcosm from the universe, basically. So if they are there in the place where that is come from that soil should matches to him, then the something imported, something come from somewhere may not matches to him. So that is the thing they say that. So that is important. So they recommend for the person to go for a seasonal food or that available in the particular place where they are living. So that is the thing they're emphasizing. That's certainly good for their normal homeostasis can be maintained. So the health conditions. Again, the udal uyirthadukal like a vali, aral, ayam also maintained at the right ratio if it is does like this. So they other than that, they try to when it goes to diet, good diet, they classify according to the taste. The 6 taste sensations are mentioned in Siddha medicine: sweet, sour, bitter, astringent, salt, and pungent. So this combination of sweets are again the primordial elements from also formed by the 5 Panjabhutas basically. So according to the condition, according to the person's condition, if it is for he is suffer from kind of Vata disease or Pitta disease, so he has to choose a food that can bring down the Vata. Similarly, if we have a Pitta is more, so the food that made up of made with other than pitta, like kapha and vata, should be taken. So they classify such a way. Similarly, the food also recommend, and according to the time, I already said that, and the season also followed. Okay, in rainy season, the different food they recommend. In the summer season, they recommend a different type of foods to maintain your normal health. That is what they're saying. Another important thing is Siddha is Kaya Karpam. Kaya Karpam means basically, Karpam means regeneration, basically. So, Kaya means the body, Karpam means regenerator, which prevents the graying of the hair, shrinking of the your skin, and healthy body, and also it gives immortality. So, and which is make you free from disease as well as increase your longevity. That is a kaya karpam. This is the only medicine that says about the kaya karpa basically. So it includes the kaya karpam, includes the as a dietary supplement or special preparations or drug, some of the yogic practice. All these are considered as a kaya karpam. According to their where they are prepared, how they are prepared, they call it their functional thing. They are classified into based on the function Podukarpam, general elixir, or these special elixir. That is, the general one improves the general health and prevent the disease. The Sirappakarpam treat the disease and improve the health. So that is called the Sirappakarpam. So again, this Kayakarpam are classified based on the how they are prepared. If it is prepared from the herb or the herbal preparation, it's called Muligai Karpam, plus plant-based. Then if it is prepared from the iron or gold or some minerals, it's called the Tadu Karpam. Tadu Karpam, they are selling it. Similarly, if it is animal product from milk or honey, it is prepared from, it's called the Jiva Karpam. So they also recommend how to take this in the along with the regular food and how long it need to be taken. For example, in case of the Muligai Karpam, that is from the single herb, they recommend ginger, pepper, and they all haritaki, kadukai. So all this they recommend to take every day. So, for example, if you take haritaki every day, powdered haritaki 1 gram with a warm water every day, morning and evening for that. So the person who have wrinkled the skin, graying hair, all will come down. He will become a young chap. That's what they suggest. They just make it as high, but that is what it is. So they recommending it as. It's called the Muligai Karpam. There are several single herbs are recommended as a Muligai Karpam. One of the specialized system that is applied in Siddha system to keep the person healthy and to prevent the disease. Basically. Another important specialty is yoga. Yoga that is help you to keep you person from the disease-free life, to conduct disease-free life. In Siddhar's Tirumandram in Tirumoolar, 3000 BC, he has it has 8 limbs of yoga process. It's called Ashtanga Yoga. We call it Ashtanga Yoga. It is called EMM. EMM in the sense, internal process to clean ourselves, introspectively get into your thoughts, what you are doing. So cleaning up your mind, it's called EMM. Then basically the yoga mean in Tamil word, it arises from the oak. Oak means connecting the body and mind. Yoga means connecting the body and mind. So these are some of the techniques. The 8 arms of them are helpful to connect them and make them to bring out the healthy way basically. So the EMM is the internal process. Niyamam is the how truthful you are doing your work, the discipline in work, and that the work that gives you pleasure and relieves you from stress. So such a way it has to be there. Is the one. Then asanas. So this is now worldwide very well known. All of you know about it. Yogasanas. It is well practiced. There are different postures that's called asanas basically. These postures are mentioned in Tirumandaram. There are different postures which can which part of the body. They not only just improves the physique, they also strengthen the internal organs of the body. That is the speciality of the yogasanas basically. All the internal organs are get strengthened. Then another yoga practice is the pranayama, controlling of the breathing. It is otherwise called vasi. So controlling of your breathing is very essential. So there are three stages they are telling: inspiration, then there is a holding of the breath for a while, then expiration, and the rhythmatic way we call it as a pranayama. So this is of the one in normally in physiologically, if you look into your lung, or there is a millions of alveoli are there. So in the alveoli, if you stretch them all put together, the surface of your whole alveoli will be equal to a football field basically. So the whole, there is a blood comes. So there is a gas exchange happens. But unfortunately, all these alveoli are not well utilized in your normal breathing. It's called physiological dead space. If a person can be able to use his alveolus efficiently, he'll get a more oxygen, more strength, more energy for him. So that is achieved in the pranayama, basically. So the ventilation perfusion ratio get enhanced. The physiological dead space is come down. The amount of oxygen you are taking, it increase. So that is the one thing recommended in the pranayama. Then pratyaharam is another arm of the yoga. So control of our five senses, basically consciously controlling our senses, is called pratyaharam. Then dharana is a concentration of mind. That is concentrating the mind from deviating from so many thoughts, putting them in keeping them in the one place. There is a little bit different between the meditation. There is a dhyanam and dharana. Dharana helps you to focus on whatever you are doing, concentrating your mind on one thing what you are doing. The meditation is a little more higher level, so there you can concentrate your mind on one thing. Again, you try to slowly forget about body and try to get tuned to what you are thinking. That is the dhyana. So another thing is the samadhi, which is it is almost next level. They say that it is equal to the God. That is, you are free from everything. So that is called the samadhi nilai, they call it as. So the highest level of doing yoga. That is the highest level of doing that yoga. This is one of the distinctive feature in the Siddha system. All this Ashtanga Yogam are advocated for the to prevent as well as the healthy life, basically prevent disease and for the healthy life. Other than that, Siddha system have some of the unique therapies. Actually, in Siddha system, we have a 32 types of internal medicine, 32 types of external therapies. The 32 types of internal medicines are given internally. So there are different forms, powders, tablets, or syrup, all that. Other than that, there are 32 types of external therapies. In this external therapies, other than that, there are some of the unique Siddha therapies are that I'm going to share with you. So the first one is the Siddha Barmam therapy, a special therapy practiced in Siddha system of medicine. It is one of the non-pharmacological intervention in Siddha. It's a non-invasive. Again, it doesn't require any big preparation or any instrument. It's a very cost-effective method applied to relieve pain and treat many musculoskeletal and neurological diseases. According to literature, Varma points means a vital energy points located in the human body. They have identified about 108 points are there like that. Okay. In that, they further classified into Paduvarmam and Toduvarmam. Paduvarmam 12, Toduvarmam is 96. According to, based on their localization and their application, they are classified into Paduvarmam and Toduvarmam by the Siddhas. So, Varma points, stimulating them for therapeutic purpose, we call it as a Varma, basically. So, the, 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 the energy focused points are manipulated, basically, by using your finger, basically. The fingers are used to manipulate. So, it can be giving a pressure or touching the point and rotating them, on pulling them the one side, pull on the other side. So again, the pressure that you are giving is varies to half, quarter, and the fourth, and one or maximum of two. So each one has a different effect. The particular Burma point, the pressure you are applying as quarter or so it has a different version. So it is very crucial. So it need practice to maintain it. So this is, we call it as a matre, the amount of pressure, the intensity is applied is called the measured in the unit of matre, we call it. So the picture shows, see, some of the therapeutic Varma points in the head and neck. Okay, there's some of the try to show here. So it is published by the Ministry of Ayush in Central Council for Research in Siddha. They have published this is some of the Varma points present in the face, basically. That also I have given the surface anatomy of the to localize them. So where the points are there and all this cell. So each has a name. So Angavarmam, Tilarthavarmam, like over each point has its own name. So simulation of this with a different intensity as a different physiological uh, physiological effect you elicit. So that is important that we are using it. So normally, several the person who do the Varma technique, basically called Varmani, we call it as a Varmani. There are several books are available in Siddha for Varma to how to locate a Varma point, what are the pressure need to be applied. So what are the other precautionary measure or need to be taken during the Varma therapy. All these are well defined in the several Siddha literature about Varma. Normally, now we are clinically applying for various musculoskeletal disorders like osteoarthritis, cervical and lumbar spondylosis. Again, bone fracture, we do Varma point, stimulation of Varma point. Again, it is very effective in children during the condition of cerebral palsy and of autism, the condition with that. In case of women who suffer some different gynecological dysfunction like metrorrhagia, menorrhagia, excessive bleeding, or absence of menstruation, all these conditions are regulated by stimulating them. So normally the pressure will be given for not more than 1 to 2 minutes, not more than that. Again, once in a day, it may repeat it for a week or something. This is the methodology used actually. Other than that, many of the non-communicable diseases like diabetes mellitus, hypertension, respiratory and cardiovascular disease, also the Varma therapy is applied. And it found to be very effective also in like psychiatric disorders, depression, schizophrenia. Also, they are using this Varma stimulation uh, things they are doing here. So again, I have shown some of the points used in this is used in the respiratory diseases, Varma Marthuvam, then the Varma Marthuvam for the eye diseases, all are given here. So that is also just I show him here. I cannot move the slide. Can you?
So no, it should be under your control, I will say.
Um,
You can't?
I can't do that.
Well, because it's your
So my computer.
your computer. Maybe in some way the presentation has a hang or something. Maybe it is frozen.
Yes. Um,
Maybe you would have to,
mm,
I don't know, reopen it. Maybe.
Stuck? I don't think so.
Because I cannot change.
Yeah, I understand. I understand. There is difficulty there to do it.
Maybe you would have to, as I said.
Restart again? Yeah,
Yeah.
I'll call my assistant.
Okay.
Yeah.
We're at such an interesting point right now. It's
I can't move the slides. How do you, can you
so while we're waiting, maybe one question, because everything else is being told and shown so beautifully here that everybody can go back and watch everything 2 or 3 times and maybe learn everything. But what would you say is the relationship to Ayurveda? Is it a complementary? Is it for our viewers who maybe just know Ayurveda as the Indian kind of medicine, and here we come with different sorts of medicine? Would you say it's a completely different style, or is it part of it?
I'll say that Siddha, I think I don't go.
Oh, it moves. It's moving.
Most?
Great. Yeah.
Yeah, it's moving. Right. Okay. Back. Go back. Go back.
Yes.
Here.
Right.
Yeah, simply.
Great. Now you're on play.
On this side, I'm on this
Right,
side.
exactly.
You want me to continue? You want me to answer now?
Just go on maybe after you're finished. But that was just the only question that had come up, so that people just understand what is the difference, or why we would have 2 different names for Indian medicine, or 3 or 4, which we are coming up.
Okay, maybe let me finish. Maybe we'll.
Right.
That will be better, right?
Just
okay.
Go on.
Yeah, please. Okay. This is some of the proposed mechanism, because in Siddha, this Varma is mostly applied for the alleviation of pain. So there are some of the studies that we conducted, how this system works, the Varma, how it alleviates or removes pain. So there are 2 mechanisms proposed, found to be close. That one is the gate control theory, that's the physiological theory. It is, we do have within our system, it is potentiated by the Varma stimulation. You can know the first one, the gate control theory, the pain that carried all the way to the pain sensing area of the brain. So there are some neurotransmitter which arises from that, which comes back and try to peptides, which comes back and inhibit the pain carrying fibers. So that is where it happens when you give a Varma. That's one thing. Then all of you know that we have an analgesia system. Human body has its own analgesic system. You may be aware of it. It is containing like enkephalin, all that is there. This balance, that's why the pain intensity of the person vary with the individual because of this analgesic system. Some person react very fast or short or a pain, but other person just ignore. So it happens that the intrinsic, the mechanism, how it works basically. So Varma tried to potentiate that, basically the Varma stimulation, which can increase this, our own internal analysis system and try to help to manage the pain. So that's the thing they proposed here. Then another interesting thing or the uniqueness of Siddha system is the Tokkanam, the physical manipulation. It is called many other names basically. It is called, there are 9 types of Tokkanam has been given based on the way they are doing it, like a tattal, then irikal, there is a compressing, gripping, grasping, holding, or twisting. So it depends upon the requirement. They do that actually. And pulling, supination, there is changing the body position and giving some pressure over that, pressing, shaking, or mobilizing, all the circumstances like that. So this Tokkanam are helpful to nourish the body cell and improve the sleep and sexual function. They also helpful to relieve the body pain and tiredness, and they also tone up the skin, muscle, and nerves simultaneously. Again, it is 2 types. Sometimes they apply oil, without oil, they do either way. That is depends upon the requirement. Recent studies have proven that it improves the blood circulation. Also, it facilitates the lymphatic drainage of that actually. Okay. So this is another one uniqueness of the Siddha system of medicine. These are some of the external therapies. It is kind of surgery that's advocated in Siddha. We call it as a Karanul therapy. Basically, medicated thread used as a chemical catheterization. Basically, it is applied in the anorectal disease, fistula in ano, hemorrhoids. So they clean up and they apply this caustic substances. The thread that is smeared with this, and they apply over that, which is helpful to cut and close the tracks. Basically, that's what it does actually. That's the Karanotherapy. Here I want to say about it, because Ayurveda, they call it the Shala Sutra. You maybe heard about it. So I'll come to the end of the talk. I'll come to that where this Siddha and Ayurveda, why the similarities and why the differences, that we'll discuss further. Then again, the leech therapy is one of the unique procedure applied for therapeutic purposes. Leech therapy, now it is all over the world. I think FDA also approved this procedure now for many things. It is one of the old method that is applied to for the rheumatic edema, tumors, and abscess, pains, eczema, and other conditions. So one more thing is a sutai, that is a catheterization, this one. It is one of the external therapy followed in Siddha system of medicine. They use the specialized instrument or a herbal twig, so to apply over that in the skin tag and what they do apply this to remove this condition. Siddha's medicine and immunity, because I think tomorrow you have a talk on this. I don't go in detail about it. You know about it. Dr. Meena Kumari, our director, is going to talk about that Siddha medicine, how it enhances the immunity. So generally, by advocating the good lifestyle, yogic practices, medicinal plant usage, some of the abdominal preparation found to be effective in the enhancing the innate immunity of the human being. So tomorrow you may know more in detail. I don't go into detail about that. So in conclusion, I say that Siddha is an holistic medicine. The strength of Siddha lies on its physical and mental, social, and spiritual well-being. By adopting a simple lifestyle practices like postures, breathing exercises, meditation, dietary regimens, and relevant to the 6 days. Then it also uses safe, effective plant-based drugs and drugs of mineral and animal origin, which is adaptable to the universe, basically. Then it also gives a unique therapies like Varma and Tokkana, which helps to give a sophisticated treatment. Also, worldwide we have a qualified and skillfully trained Siddha physician nowadays, so which all together gives a human community a great medicine to all in the preventive as well as the treating the disease. With this, I conclude. Thank you for the opportunity. I should thank my directors who has allowed me to give a talk on that. My special thank to Vinayak Mahayer and initiator and chairman, and also the team, the organizing team, Knowledge Festival, open. Thank you one and all.
Thank you, BRF.
Thank you, Shankar Narayana. Thank you.
Okay, thank you.
Thank you for hearing. Okay.
Yeah.
So just thanks a lot. That was really so full of information and just great. I would recommend everyone to just go back and look into it. It was really just filled with information, and you gave us so much of your time. I really don't want to take up any more of it. And as you said, we will have more of these pre-talks, and hopefully one of these days you come back and tell us more on certain other topics. And for now, I just say thank you and goodbye, and see you next time.
Do you want me to answer the question?
Oh yes, sorry. Yes, just in short, we know, of course, it's a different thing, but just how would people in the Western world put it in context?
Indian, the continent, different people, different regions, they practice a different type of medicine, the same medicine at a different places, whatever is available. It's named out based on that, basically. So the people who practice in northern India, their language is Sanskrit, so they have written the scripture and all. So it is vary with the place, that's all. It's almost similar, but again, according to place, it has some specialities. In Siddha, some of the unique things are there, like metals and minerals which is used, or that is very specific to Siddha system of medicine, all that again. So again, Ayurveda has its own strength, everything. So ultimately, everything good for the human beings, basically. Yeah, that's all. Okay. Actually, we can talk another day, because there is a big thing happened because when there was a British rule, it was only Indian medicine. There is no Siddha medicine, there is no Ayurveda medicine, only Indian traditional medicine. Okay. Once they started to document this, they slowly get differentiated that. So the medicine that is practiced somewhere in the North India is written in the Sanskrit are considered as a Ayurveda, and again some of them that is developed from the Tamil speaking area considered as a Siddha medicine. That's what happened. So the name Ayurveda and Siddha are even gained in the later beginning of the 18th or 19th century only. It happened once the British comes only. Before that, it is all considered as one Indian traditional medicine. That's it. So that's what it is actually. Okay. So it was called as grandma's medicine. It was called as the homemaker medicine. All this. But once you started documenting all that, the British colonial rule, they only first started this. Otherwise, before that, it was there everywhere, kind of started.
So it's basically a whole medicine altogether, but with local colorings and certain techniques that some developed and some do more. So basically, there is a lot of connection in
Yes.
there, and people can. So all right.
Okay.
Thanks
Thank
a
you.
lot.